Hey guys, so today we'll be starting with your metabolic disorders of liver, all right? And the first topic we'll be starting is hemachromatosis. Um, so let's start with the definition of your hemachromatosis. This is an iron storage disorder where there is a excessive accumulation of iron, all right, in the parenchymal cells, and this leads to eventual tissue damage and functional insufficiency of the organ. So there is tissue damage of the organ and its functionality is also affected. All right. And the most common organ affected is your liver. All right. And it also affects your heart, pancreas, skin, pituitary, and etc. All right. Which we'll be reading as we move ahead. So let's start with the etiology. All right. For the etiology, we'll be dividing it under two headings. One, primary and secondary. What are the primary causes and the secondary causes? So the primary causes are usually your genetic causes. All right. These involve three genes. All right. I'll explain these genes further, but just note them down now. There is your HFE gene mutation. All right. Then there is your HJV gene mutation, and there is TRF1 and 2 gene mutation. All right. Now, coming to the secondary causes, these are your hemosiderosis. All right. Then there is your Bantu siderosis and repeated blood transfusions. All right. Lastly, it is your chronic alcoholic liver disease. All right. I'll be writing liver as this drawing. All right. So, yeah. Coming to the pathogenesis. So we studied these three genes here: HFE gene, HGV gene, and TRF1 and 2 gene. So the most common cause for your adult hemochromatosis is the mutation of the HFE gene. All right. Secondly, the most common cause for your juvenile hemochromatosis is the mutation of your HJV gene. All right. Now, the last gene that we studied was your TRF1 and 2 gene. So what happens here is that there is mutation in TRF1 and your 2 gene. All right. So this gives rise to something called as your HAMP gene. All right. Now, this HAMP gene leads to decrease in the structural and function of hepcidin. All right. So this leads to increase in your ferroportin. All right. Now, because of increase in ferroportin, what happens is that your mucosal ion moves into your serum ion. All right. Now, this serum ion can be of two forms. That is your transferrin and ferritin. All right. So, after a while, what happens is that, yeah, this serum ion is free. Yes. So, this ends up becoming toxic. Okay. Any ideas why? Because of increase in your ROS, reactive oxygen species. All right. So this increase in your ROS is the reason for your organs getting affected. All right. So all right. So this is how our organs get affected. Now let's study what are the organs getting affected and how are they getting affected. All right. So the most common organ that is affected is your liver. All right. So let's see what are the changes that we see in your liver. So the first change we see is your hepatic failure. All right. Second, we see healing by fibrosis. All right, which leads to your cirrhosis. Thirdly, there is increase in risk of HCC, hepatocellular carcinoma. All right, and lastly, there's increase in pigments in the Kupffer cells or Puffer cells. All right, yeah. So the second organ is your pancreas. All right. So what happens in your pancreas is that your beta cells, okay, of your islets of Langerhans get affected. Okay. So if you guys would have watched the diabetes mellitus video, you would have known that the beta cells are required for your insulin production. So what happens if your beta cells are affected? So there is no insulin. All right. So this will lead to diabetes, but which one? To be more specific, it is your type 1 DM. All right. Now, thirdly, your skin. All right. So what happens in your skin is that there is your inflammation of the skin. All right. And secondly, the skin turns brown. It's called as brown skin. So what happens here is that your hemosiderin deposit in skin. All right, which leads to inflammation. All right, which leads to increase in melanin. All right, giving rise to the brown color. All right, now because of this brown color and this type 1 DM, these two are collectively called as, or this condition is called as bronze diabetes. All right, okay. So now the fourth organ getting affected that we'll be starting is your pituitary gland. All right, so what happens to the pituitary gland is that there is damage to the cells which are producing your growth hormone. All right, so damage to growth hormone producing cells. All right, so this leads to your stunted growth. All right, now fifth, the heart. All right, what happens in the heart is that we see dilated cardiomyopathy. All right, and sixth, your joints. All right, we see something called as pseudo gout. All right, this isn't exactly gout because we know what happens in gout. This is a different type of, that's why it's called as pseudo gout. All right, now, so these were the organs affected. There were 6 organs. All right, so now we'll be coming to the investigations. All right, so the first investigation is your serology. All right, we will look at the iron profile of the patient. All right, so what does the iron profile show? That the serum Fe is increased and your transferrin saturation is also increased. All right, the second thing that we can do is your liver biopsy. All right, now the liver biopsy is your gold standard investigation. All right, for this condition. So what happens is that your hemosiderin deposition in hepatocyte. All right, so this is what we check it for. uh, it stains positive for your pearl Paschen blue. All right, all right. Now the third investigation we can do are some genetic investigations. We can look for autosomal recessive inheritance. Yes, and second we can look for your HFE gene mutation. All right, lastly, the treatment for this condition is your iron chelating agents. All right. So with that done, we'll start with your second liver metabolic disorder, that is your Wilson's disease. All right. All right. Now, starting with your Wilson's disease, let's start with its definition. All right. So, Wilson's disease is an autosomal recessive disease, all right, of copper metabolism. All right. Now, Wilson's disease follows a triad of features. All right. Let's have a look at what are these triad of features. All right. These involve three organs: your liver, your brain, and your eyes. All right. So in liver, what we see is cirrhosis. All right. In your brain, what we see is that there is your bilateral degeneration of the basal ganglia. All right. And thirdly, what happens in the eyes is that we see this characteristic finding called as Kaiser-Fleischer ring, also known as KF ring. All right. So what happens in this is that there is greenish brown pigmented rings. All right. In periphery of cornea. Yeah, it's around the limbus. But this characteristic finding is relatively harder to see in us Indians and Asians because of our iris being darker colored. It is a more prominent finding in the Western. All right, so before we move ahead to the etiopathogenesis for your Wilson's disease, let's understand the physiology of your copper metabolism. All right, so let's try to understand this rough diagram. So this is your duodenum, this is your liver, and this is your portal vein. So what happens is that copper is absorbed into the duodenum in the presence of your ATP7A. All right, then it enters your portal vein, and then it moves into your liver. All right, so what happens is that copper in the presence of your ATP7B, all right, combines with your apoceruloplasmin, and the excess copper, it combines with your ATP7B, all right, and it um, combines with your bile and is excreted out through your feces. The remaining excess copper, all right, moves into the blood and is excreted through your urine. All right, so this was the physiology of your copper metabolism. Now let's move ahead to the etiopathogenesis. So we saw here that there were two things required for your copper metabolism. The first one was your ATP7A, and the second was your ATP7B. So for any problem to occur in your Wilson's disease, there has to be some problem in your either ATP7A or ATP7B. All right, so let's study the etiology first. All right, if there is mutation in your either ATP7A or ATP7B, what happens? So if there's mutation of your ATP7A, it leads to this condition called as Menkes kinky hair disease. All right, and mutation of your ATP7B leads to the topic we are studying, that is your Wilson's disease. All right, so coming to the pathogenesis, we learned that there was mutation of your ATP7B. All right, now this leads to, first thing, in your liver, increase in your copper. Yes. So what are the first thing that's going to happen to our liver is that there is ROS injury. That is your reactive oxygen species being accumulated in your liver, leading to the injury. All right. Second, the copper binds to the sulfhydryl group of proteins. All right. And thirdly, copper replaces, all right, the metabolic ions in enzymes. All right. So all of these three things lead to the damage of your hepatocytes. All right. Now, this leads to firstly your hepatic failure, second, cirrhosis, and thirdly, this increases the risk of hepatocellular carcinoma. All right. Now, because of this hepatocyte damage, what happens is that the copper starts moving into the blood. All right. Now, the copper has moved into the blood, so it goes to different organs. All right. And what are these organs? We've already studied them. All right. The first, your brain, and second, your eyes. In brains, it causes the degeneration of your basal ganglia. Yes. All right. Which leads to, firstly, tremors. Second, lack of coordination. Yes. Go back to your first year physiology. All right. Your basal ganglia, damage, copper accumulation. What would you call this condition as? Huh? Yes. Parkinson's. Yes. And in eye, we already studied that is your KF ring. All right. Now, coming to the investigations. All right. We'll start with your serology. All right. One, two, and three. The first thing is your serum ceruloplasmin. All right. Is decreased. Second, urinary copper is increased. Thirdly, serum copper is, this is not used, okay, because it has a very fluctuating value. All right. Now, the second thing that we'll do is the liver biopsy. All right, and this is gold standard investigation. All right. So in this, what do we see is that in the microscopy we see copper in your hepatocytes. All right, this is almost brown color. All right, and this brown color we can stain it with Orschen stain, and second is your rhodamine stain. All right. So those were it for investigations. Now coming to the treatment for your Wilson's disease, we can use your D penicillamine, which is your, okay, and second we can use zinc, and thirdly is your tritane. All right, so that was it about your Wilson's disease. We have studied two metabolic disorders of your liver. We studied your hemochromatosis, which was an iron storage disease. Then we studied your Wilson's disease, which was copper metabolism disorder. All right. The next topic that we'll be studying in your metabolic disorders of your liver is your alcoholic liver disease. That is a relatively larger topic, so I'll be making that in a different video. Thank you guys for watching, and yeah, keep watching. Take care.